Hello, everyone. Good afternoon or good morning, maybe even good evening, depending on where you are in the world today. I'm happy to welcome you at our conference on integrative medicine, where we're hosting a big event which includes many speakers. And now I'm more than happy to welcome our next speaker, Vaidya Balendu Prakash, who is an acclaimed Ayurvedic physician, cum scientist. He is also a founder of Deptof Specialty Ayurvedic Treatment Center, Vaidya Chandra Prakash Cancer Research Foundation. Vaidya Prakash was born into a family of Ayurvedic practitioners, and today he practices one of the 8 classical forms of Ayurveda, which is called Rasa Shastra. He has also developed some innovative treatments for certain chronic diseases, and today he's going to be giving a talk on evidently effective treatment of leukemia through Rasaushedis. So let's welcome our next speaker, Vaidya Balendu Prakash. The floor is all yours.
Okay, thank you very much for my introduction. And first of all, I would like to thank the organizers of International Conference on Yoga and Ayurveda for Cancer, especially to Mr. Satyam Agarwal and his charming assistant, Mrs. Nurun, who had been both of them were very supportive in the preparation of this conference. So I'm glad that I'm on this forum today to share my experiences in the treatment of leukemia. And as you all know, leukemia is a type of blood cancer. And I have a family background. My father was an Ayurvedic doctor. And we never tried for it, but in early 60s, my father could treat 3 terminal cases of leukemia. And at that time, it was a primitive treatment. There was no chemotherapy. But he used to prepare medicine using Rasaushedis. Rasa means mercury. So he was preparing mercury under the guidance of his Guru Maharaj, who was yoga and Rasa Charya, the master of Rasa. But when he could treat that, the second time his Guru and he could not formulate it further. So I joined my father after doing my science graduation, and I could see certain successful cases. I could see many failures. And then, but I had a strong conviction that there is a science behind it. So I started doing my science and Ayurveda. But what I learned in modern science, that modern science talks less, present more. Good or bad, I don't know. But evidence is the key. And I always say evidence is knowledge and knowledge is evidence. So I will not much speak on the theories. I will share my first experience. And this is the case which was recently published in an International Journal of Oncology, which is published from Hong Kong. And first time the author, editor informed me that the first time they have taken any case report outside conventional medicine domain, which we call in India allopathy. So this 10-year-old boy was diagnosed in December 1982 with a form of acute promyelocytic leukemia called AML3. And this time there was no ATRA, no chemotherapy. And only treatment was blood transfusion because of the low platelets. So he was treated in that condition by my late father, Vaidya Prakash, and he gave the medicine, which I will narrate in my upcoming slides, part of the medicine. And this boy showed immediate recovery within hours, and now 37 years disease-free survival. I would like to say this is the longest survival of an AML case, de novo, means who has not taken any medicine in the world. The second case is again a landmark case in my history, in my professional life, when this 3.5 years old boy, when he came to me, he was 6 years old. He was diagnosed with acute lymphoblastic leukemia. He was all treated in Royal Marsden Hospital, London, with chemotherapy, radiation, and underwent autologous bone marrow transplant in January 1986. But the boy relapsed within 6 months, and that time his prognosis was declared as bad, 3 weeks survival. And that time he had 25% blast and pancytopenia and fragile physical condition. I treated reluctantly because I had no experience in the past, but the treatment which I offered helped him and he lived. He became symptom-free, disease-free, hematological remission. But one thing happened to him. After 1 year when his bone marrow was done, it was 50% blast from 25%. Then the treating doctor said that maybe IVD treatment stops the necrosis by the leukemic cells and enhance the immune system. And this treatment continued for quarter to 2 years in the beginning. And that time, boy became complete remission. And after that, I treated him further for many more years. But it was not for leukemia, it was to strengthen his system and thing. The boy survived 19 years, and after that, he died in a major car accident in Ireland. This boy is again very interesting case. When he was diagnosed in June 87, first in Aga Khan Hospital, Karachi, and then Great Ormond Street, London, he was reported as the 4th case in the world for acute megakaryoblast leukemia. And this time, there was no chemotherapy, no protocol was there, and only transfusion. So he was brought to me due to our old reputation in the treatment of leukemia. And this patient who came under a desperate condition as there was no treatment, and this boy is still alive, lives in Pakistan, and he has disease-free survival, 32 years. And I would again like to say that acute megakaryoblast leukemia and 32-year survival is never heard of. There are many such cases in my clinical practice, which completes now 42 years, and I have work of my father also. So there were the relapse cases, refractory cases, defaulter cases of APML and other forms of cancer. And this was reviewed by Indian government by setting a fact-finding committee under Ministry of Health and Family Welfare, which was in 61, 1983, 1988, and 96. Though all these fact-finding committee found prima facie evidence in the treatment of leukemia by using Rasaushedis and recommended for further research, but due to many bottlenecks in the system, this could not pursue further unless when a patient treated by me, the first case which I presented today, his cousin became Health Minister of India, and with his intervention, Government of India sanctioned me a first pilot project where was a cancer subcommittee consisting of experts from All India Medical Institute, Indian Council of Medical Research, Central Council for Research in Ayurveda and Siddha, comprising of oncologists, pharmacologists, estheticians, etc. And this committee set up a protocol that all the patients will be diagnosed and followed up in IRCH, Indian Rotary Cancer Hospital, All India Medical Institute, New Delhi, which is the premium most. And under that protocol criteria, total 15 cases, out of those 8 relapse cases and 7 de novo, the fresh cases were enrolled in the study, and all those cases were diagnosed for bone marrow test and blood parameters. So this treatment, which consists of Navjeevan and Kamduda, blood transfusion was given if platelet was less than 20,000 and hemoglobin was less than 8. Antibiotics were given for identifying the secondary infection, and 4 patients died at the 3rd day, 7th day, 11th day, 20th day, but 11 patients could complete the accepted 90 days treatment protocol. And after 90 days treatment protocol, it was found they were absolutely disease-free, hematological remission and complete remission was there, bone marrow was normal, and there was no adverse effect. So this treatment has achieved US and European patent, and now Government of India has sanctioned a project to develop drug master file for this formulation. We made some international impact by submitting our 13 cases to under best case cancer series in National Institute of Health, USA. And as you can see, the first case, CLL, has completed now 16 years. Disease-free survival, the cases of AMLM3, disease-free survival 20 years. ALL with hepatitis B, refractory stage, you can see 20-year survival. AMLM3 relapse case, 25 years. Non-Hodgkin lymphoma with bone marrow infiltration, which is again an aggressive form of disease. The patient, though well, disease is slowly progressing, but still the patient is alive for 17 years. Again, M0 case, it is a relapse case in bone marrow, has lived 23 years. It has also been published as a case report. And again, I say second relapse of M3, who has the patient who has taken more than 300 blood transfusion, is now living 24 years disease-free, 26 years. And then ALL, refractory cases, it was for 16 years survival. And this lady died of acute hepatitis, maybe due to the chemotherapy he took in the life that was told by the doctors. And Williams tumor operated, then second is to lung, second is to other place. This boy had undergone 4 major surgery, 31 chemotherapy, and every other day there was a relapse of the disease. But after starting Ayurvedic treatment in September '89, now this boy has completed nearly 34 years, disease-free and symptom-free, and adenocarcinoma of stomach. You can see here, the patient lives 15 years. So these are the cases which were discussed at length in NIH, because when I submitted there, they invited me, we discussed for 2 years, 2 hours with many experts. But they were, though they were impressed with the efficacy, they had no clue how to proceed further. And second thing, there was a demand to provide original slides, and which is impossible in India. We have all written reports which were submitted earlier. So though it was published on the newsletter of OCCM in 2010, which is available on the net, we could not go ahead further because NIH doesn't have any facility at the moment to use inorganic compounds like metals which are toxic, convert into non-toxic form. So, but our evidence is there, and they continue. And this is evident when Indo-US team came into India in 2016. Our Indian government presented our success story. As I told you, that fall 2010, NIH has put these minutes in their cover page story. And there was another meeting of government of India and USA in 2018. Again, government of India presented it as a case story. And besides, we are doing one thing, we are taking one by one cases, because there are many things which cannot be accepted in the world, because what is our medicine? We take raw material, convert into medicine form, but what is the chemistry? We are lacking into that, mode of action lacking. So what we are doing to create our mark, we are presenting one by one these cases into different journals. So far we have published 5 cases as a single case report, and these case reports are itself a big question to the people. How come leukemia could be treated without chemotherapy, without radiotherapy, or without anything? These are the result purely through metal-based Ayurvedic treatment. And what is the logistic of Ayurvedic treatment? I'm talking about Rasa Shastra. Rasa Shastra came into Ayurveda during 1st to 5th century. At that time, there was a university, Takshila, which is in Pakistan now, and where a new experiment was started, converting low metal into precious metal. And one Acharya Nagarjun, who said that if I make the processing of Mercury, I can. So this science initially developed 1st to 5th century, and by 8th century it was documented. And this was the time when India was known as golden bird in the world, and people were attracted to that. So this invasion and then British rule and Mughal rule to the country created a big havoc for the science, because it needs a quiet area, and number of years of processing, 5 years, 10 years, generation to generation. But in that process, it was restricted to certain sadhus, sages, and under Guru Shishya, student and people, student and masters chain. And in that chain, it was with my father's Guru, and my father's Guru gave it to my father, and I'm doing in the tradition. Though I'm a science graduate and graduate in Ayurveda, I took Rasa Shastra as an interesting subject, and I can see daily basis that how we take metals, and metals which are toxic in raw form are being processed continuously for years, and they convert into non-toxic and therapeutic form. And while we do so, Mercury is processed with herbs, Mercury is processed with certain things of animal like milk, dairy, etc. They are part of these things, some mineral together, and these things are able to convert these into non-toxic and therapeutic form. And what is working hypothesis behind it? So there is a science called Dhatu Vigyan. Dhatu means metal, Vigyan means science, science of metal, and it talks about Dhatu. Dhatu is a Sanskrit word, Dharadan Dhatva. Dharadan Dhatva means which bears. So they say that gold, silver, copper, iron, lead, zinc, and tin, the essential metals are basic constituent of our body tissues, but not in a metallic form, into ionic form. And any imbalance of these metals in our body tissues due to irregular diet, lifestyle, or environmental eco-factors that disturb our body metabolism and our body produces the disease. So this is the one step towards the cause, hetu. And if we see around the world, we are seeing that our pulses are decreasing in proteins, they are decreasing in minerals. So whatever disease we are treating, when we find the minerals are working on that, so that is strong, that basically strengthen our hypothesis what we are doing this. So after treating so many leukemic patients, I can easily say that leukemia is a outcome of ions of metals in the body. We get metals nowadays, but in more toxic form. But traditional processing was able to convert this toxic material into non-toxic form. So here we come back to silver. Silver, the clue of the medicine of the leukemia is silver, and silver is present in marrow, bone, outer inner linings of biliary tract, stomach, nasal cartilage, and brain, and auditory glands and lung muscles. There is a literature which is handwritten. It talks about it, and I've seen these metals have a special effect on that. I don't know how did they know about it, but when I prepare this medicine and we give it to the patient, and when they feel better, so our hypothesis, our belief gets stronger and stronger. So why these metals get lesser in our body? Sometimes genetic factor, sometimes we are not absorbing well, and third thing is either less or more eating, irrational diet and lifestyle. This can be caused, this may be causing the imbalance of metals in the body. And this silver is converted into Bhasma form. But silver, if you can see, that silver is the only metal which was using as a thin foils in our day-to-day life, especially in sweets and other things, and that was part of the rituals. And even in the beginning, I remember when I was a very small child, my grandmother was giving me bowl and spoon, etc. of silver, so that child is doing that. So gold and silver are essential part to boost up our immunity. So the silver medicine, and there is the formula. This silver has converted into silver Bhasma. Bhasma is nothing, it is oxide form, and this is the crux. So it takes us to 3 years. There are many silver Bhasma present in Indian market, but this formula will not work properly. So here we will talk about, yes. So these metals are converted into different forms, and then some herbs and some minerals are mixed together, and this medicine is made. The second medicine we used in this process is made of mercury, and mercury is again a toxic material, but with our processing for 9 months, that mercury converts, then it is added with sulfur, and this sulfur and mercury goes for years and years. They are grind and heated again, and we usually add 100 times of sulfur into 1 part of Mercury, and then it's called Gandhak Jarna. Uh, this, this assimilation of sulfur on fire. So usually sulfur evaporates, and when this final product is ready, then it is added iron and these few herbs, and which is mixed up in other herb juice, and that is called make. So we found that combination of these medicines either alone are able to change the natural history of leukemia in many cases. So it says that there is a strong prima facie cases about the anti-leukemic properties of these formulations, but this is not enough. This is a path. It shows that something is possible, something is happening. What is needed? What is the chemistry behind it? We have to understand the sequential changes. We tried our level best with the help of a leading institute of India for a different medicine. And what we are seeing that what we put in the beginning, nothing is available in the end. So these formulations which I have narrated here need to undergo scientific scrutiny, then pharmacological scrutiny, safety studies, and randomized control study so that we can do. So there is a big need to blend traditional knowledge with technology uh, to take this science, which is helping so many people, to the world in more scientific way. And with these words, I say thanks to all of you, especially to organizers and all the audience who are watching me from all over the world to listen my tiny experiences in the field of leukemia. But I must say that these are amazing results, and leukemia can easily be cured without using chemotherapy, without using radiotherapy. And once they're cured for ever, and there is no side effect to that. Big thanks.
Thank you very much, Vaidya Prakash. It was really an amazing presentation, amazing talk. I'm sure for many of our attendees it was groundbreaking. I've never heard of such studies or such approaches before, so it was definitely very eye-opening. So now we can begin our question and answer session. I see. Let me see if our attendees are ready to come up with some questions. Let's see, and then we can refer to our Facebook Live as well. Okay, I see one raised hand. That's Barbara. Barbara, you can now unmute yourself and start asking your questions to Vaidya Prakash. Go ahead, please.
Thank you very much, Victoria. I agree. It's absolutely different science, very exciting. So my question is, nowadays we have a lot of pollution, and I think some materials like aluminium or mercury maybe are in our body. So when a person has some toxins like other metals in the body, good metals like silver, as you mentioned, can flush them out or can work with them, or is it get inhibited due to our pollution nowadays?
Oh, thank you, Barbara, for your question. You see, I have been all over the world, and many times I met people who are talking detoxifying and taking away the metals. So I think they may be right, but my experience is limited to leukemia, and when they come to me, they are in such a form that if they are not treated, they may die within weeks or within days or maximum in 1 month. So that time, our focus is to treat the disease rather than doing it. And what I have been told by the experts, that these medicines which I'm giving, they neither, I don't know what they are doing. That's the biggest question. But it seems they are working towards host body defense mechanisms, that is biological therapy, and hence the entire immune system from cellular level to tissue level, and body stops producing cancer. So I will not be able to give exact answer to the thing, whether they are depleting or adding or doing things, because that is not thing, because our focus is to treat leukemia. How it is happening now, the question to me that after seeing so many success, there should be a scientific backing to this work.
Yeah. Thank you.
Thank you. Welcome.
Let's see if there are any more questions. I'm just checking out the chat. Okay, another question from Anuradha is is asking whether this treatment works for somebody who's going through chemotherapy. But I think you've already partially answered this question in your previous, but if you would like to elaborate a little bit more, we will be more than welcome. You'll be more than welcome to do so. So the question is whether this treatment that you're applying works for somebody who's going through chemotherapy, or it hasn't been tested yet.
So you are raising the question, or that person will appear?
No, I just the question. Sorry, the question was typed in the chat box.
Okay.
So the person already asked the question. I'm just asking on behalf of this person.
Okay, thank you for your question. As you can see, Victoria has mentioned that these all case reports which I have submitted or the studies I have done, they are not with chemotherapy. Either these cases have gone into chemotherapy, they were okay for some time, then they relapsed. So whenever we treated patients, there were no other anti-cancer treatment. So this treatment was given independently. I hope I'm clear to you.
Yes, so it was a standalone treatment. No other treatment was going on at any time. Okay. If you don't mind, I have got a question, so I would like to ask you too. You were saying that these raw metals, they're toxic in the nature, so they go through some process, they undergo a series probably of processes through over the years. Can you tell me a little bit more what kind of processes, and also in what form are these metals taken eventually?
Okay,
what is the solution? Yes.
Okay, I will tell you, like silver. When we take silver, it is a 999 silver, which come in a rock form from the market, like a brick. And when it comes to us, we will melt it. We will make the small rod, and under the roller, they come into thin sheet. These thin sheets are cut, and they are mixed with mercury. Now, when we say mercury, mercury is a liquid form. It comes in a bottle. And this mercury goes under processing of grinding and heating and evaporating for 9 months. And what we see in atomic spectrophotometry, that mercury remains mercury when you see it physically, but outer orbit of atom becomes more active when it completes 9 months of processing. So we call it processed mercury. That processed mercury is amalgamated with silver. And when they're grind together, they become one piece, like powder form, white powder. Then we add sulfur into it. Sulfur is again processed. And then there is a hartal, is an arsenic trisulfide, which are all things. So we are making a ball, and this ball is grinded with some herbs. And when it is dried up, it goes into fire. When it goes into fire, when the things come up, when you cannot see any of this, again we are putting into herbs, grinding and heating, and what we see that gradually metals start disappearing, which is done under XRD test, which is a non-destructive, and by the time we repeat this process 100 times. So this is a grinding and heating, getting more and more disintegration, and the finished product is a mixture of certain minerals. So there is no free sulfur, free arsenic, free sulfur, free mercury, nothing is there. And similarly, there is no toxicity. It has gone acute, subacute, chronic toxicity. And one more interesting thing, it doesn't work on cancer cell layer. So many scientists came, they took the medicine and tried on cancer cell layer. It doesn't work. But the patients are doing good and they are well diagnosed cases. So this is the science of converting into mineral science. And because these metals all alone are toxic, but when they, like sodium is toxic, chlorine is toxic, but sodium chloride when it goes to the body, it can save the dying patient. Same situation is here, that mercury is toxic, silver alone can be toxic, sulfur can be toxic, arsenic can be toxic, but when they are coming together, forming a mineral form, they are giving this result.
Fascinating. Thank you. Like some magic potion. Okay.
We have a lab in northern India where we undergo, and if you want some time, we can have a live workshop how we make this medicine. I can show you all because I don't believe in secrecy, because if I tell everything to you, you will take 10 years to follow me.
Yes, that would be amazing to see. Honestly, I'm sure a lot of people will be interested, and we can make it into a whole live show. Okay, but let's get back to the questions from our audience. Let's see what's happening there. I'll just get one more question from the chat, and then I see there's a raised hand as well. Okay, the questions are related to preventative measures for leukemia. Are there any such things?
See, I told you that I believe in facts. I believe in evidence. I cannot say that if somebody is not having leukemia, it is due to me. So I think we need to do a larger study in a high-risk cases, and then only we can tell about it. But I think Rasa Shastra, Rasaushedis, they play an important role as preventive medicine because we in COVID era, today we are living, and I know many people who are taking these medicines, none of them is getting it. So, and though we are getting exposed because we don't use mask, we don't do sanitization, we are moving around, and we are also curing them successfully. So these are immunomodulation. So cancer is again an immune reaction to the body. So question is good, but it needs more scientific backing.
Okay, there's a question. It's regarding a patient who's been taking Gleevec medicine for the whole time, for 10 years. And the question is whether it would be safe to switch to Rasa Shastra.
See, Gleevec is a medicine which is being used for a particular type of leukemia, chronic myeloid leukemia. And if you can see my slides, I have only talked about acute leukemia, which is more fatal. So I don't deal with chronic leukemia because chronic leukemia, modern medicines are able to give 2 years, but acute leukemia kills very fast. So my more emphasis is on treating acute leukemias, not on chronic. So in this case, I will say you continue with Gleevec because you are being treated for chronic myeloid leukemia.
Thank you. Okay, so the question is this, copper utensils like water bottles are popular nowadays and have said to have good health benefits. Is this true and recommended? I also personally know about having like a silver utensil in a jug with water and things like that, and also keeping some minerals in water. What's your experience with this?
You see, if because silver and gold were being used in our Indian tradition, our big people were eating basically gold plate or silver plate, gold spoon, and these toys were made up of silver so that child was playing, and when they were licking it, so and silver was as a foil. So if you take silver utensils for water and food, because silver is less toxic to the body. When it comes to copper, so you take water while putting into copper utensils for overnight, that is good enough. But there are few people who took copper all the time for everything, they got copper toxicity. So one has to be very careful while dealing with it. But silver and gold are things which can be used as utensils and can be used more frequently. But when it comes other metals, people have to be careful, but they are beneficial to the body.
Question regarding more like a follow-up question to the previous one regarding the utensils and copper water bottles. If there's a strong a strong smell of copper when you're drinking this water, is it a worrying sign? Should we not drink this water? that smells of copper?
Yes, if there is a smell of copper into water, that is a bad sign, because it is written in our text when we make bhasmas. Bhasma means ash. It has no taste, no odor. So that is the first condition, or its quality parameters, no odor, no taste. So if the water has having copper taste or odor, that means it has contaminated with that, and it is strongly recommended not to use.
Okay, so I suppose the question was this wearing of jewelry, which is made of precious metals like silver and gold. Do you think it was made in the ancient days? It was also because of its beneficial qualities, of the beneficial qualities of metal.
So when we use these metals as a jewelry, so they come in contact with our body and the skin and the sweat, and with this ionic absorption through skin, they are beneficial for the body, and that has been tradition, and people are saying it, that the people who are wearing jewelry, they get more prosperity because they don't get sick. So wearing gold chain in the neck, rings or other things are essential and good because they react with the sweat, and ionic absorption, slow and continuous, is good for the body.
Thanks, Victoria. Hi, Dr. Vaidya Prakash.
Hi.
I have a question relating to so far the data has been amazing. I'm just wondering what the challenges you face so far, sharing with the rest of the world, because in every other place, leukemia is considered really deadly.
See, I have been doing this practice for many years, and I could go to all over the world, met many top experts, scientists, researchers, philanthropists. Everybody talks about there should be research, but how to do it, where to do it. So I see the bigger challenge in the form of lack of support. People take it as a mistake that it is working. They are impressed. But when I talk about a systematic research on this system, so there is no charity in the whole world to support such an innovative and visible effect. So when I treated a patient of leukemia who relapsed after bone marrow transplantation, that year Royal Marsden has done 40 bone marrow transplants. But after 1 year, only one child survived who came to us. So there was a big correspondence, everything came. But people are in a dilemma what to do. Same thing happened in NIH. They embraced it, they wrote it, but they don't know how to do it. So my submission is that this science which I'm carrying is a losing science. Even people in India are not doing it because time consuming. It takes 3 years, 5 years to make this medicine. But it is in the beginning, but then it can come to a rotation. So I see the challenges, and I'm grateful to the organizers for bringing my work in the public domain, because I know what I'm doing. It is very promising and I'm proud of myself. But if we can ignite the minds of few people who come together, so we can kill all the challenges and we can make people laughter and better, because leukemia treatment, it is the same as this was in 1960. The patients are diagnosed, patients are treated, they remain well for some time and they relapse and die, even after bone marrow transplant. So your question is very relevant, and my life is full of challenges, full of opposition, full of many things, but the way I'm taking it forward, it is quite thing. And with this acceptance of my work in a mainstream journal makes me happy, because 30 years survival. So I think in coming years, more and more people like you will come forward, will encourage my moral, and they will support, and with that support we will come out with all the challenges, and these challenges will be converted into opportunities. Thank you.
Thank you so much for sharing that. It definitely needs to go out to the public and to be shared much wider platforms.
Thank you.
Next one up is the question from Radha Tiwari. So Radha, you can just unmute yourself and please go ahead with your question.
Vaidya Prakash ji, namaste sir.
Namaste.
I am from Karnataka sir. हिंदी में बात कर सकती हूँ?
बिल्कुल कर सकती है, but other people will not understand.
आप आंसर इसमें अंग्रेजी में दे दें.
Okay.
इंग्लिश अच्छा नहीं है इसलिए सर.
Okay.
सर ये कॉपर बॉटल्स यूज करते हैं ना, हम क्या हम पूजा में सब भी वो यूज करते हैं कॉपर बॉटल्स एटसेट्रा, तो भी उसको कैसे अंदर धोए, ओके अंदर काला सा लग जाता है ना, वो यूज करना है या तो वो धोना है या तो किस तरह से क्लीन करना है वो पता नहीं है, वो थोड़ा सा स्मेल भी आता है, उसको क्या करें?
Okay, the lady is asking about the cleaning of the copper vessels. It is very important to clean copper vessels very neatly. Otherwise, it will develop copper sulfate, which is a poison. So there should be no smell, there should be no taste, and clean it properly. And usually, if you can use dung ash, old time they were using cow dung ash because these chemicals which you use, they are not able to eliminate that. You take ash, cow dung ash, and this we call rag, and clean it properly, so because there should be no odor, no taste, and no color to that. Otherwise, it can be fatal to anybody.
सर उसको क्या है, इमली यूज करते हैं या तो नींबू यूज करते हैं ना, वो भी यूज कर सकते हैं?
नहीं, but rag with imli and lemon is good enough. Alone imli and lemon will not do it because you need something rough to clean it properly.
Okay, sir. Thank you.
Welcome.
Hello.
Yes.
Hello, sir. I'm Dr. Satyam speaking.
Dr. Satyam.
Very much fascinated about all those things which you have been doing, which normally Ayurveda, which is being propagated everywhere just as a herbal science, where we know that it is also a combination of mineral science. So if we say this to an international community, that can we say that we are also trying to be, can we say that we are also trying to integrate the mineral science to the chemotherapy and radiotherapy kind of treatment, which can be progressive but with lesser side effects?
Dr. Satyam, your question is good enough. And when you talk about the science, this study which I presented, it was done under the aegis of Central Council for Research in Ayurveda and Siddha. One side, we have seen the limitations of chemotherapy, radiation, transplant. Other side, we have seen the benefit. So there is a benefit. Sometimes we combine both the therapy when we are not seeing the benefit. So yes, I welcome your suggestion. We can make 2 arms with chemotherapy and this, but these are all scientific study. In my clinical practice, I never did it or nor I will do it because I will be always scared. Maybe there is an interaction because sometimes 2 therapies don't come together. So many people are combining Ayurveda, especially oral things with chemotherapy, and it has been seen that sometimes they hamper the the effect of chemotherapy. So when we say we are detoxifying, so maybe you are minimizing that. So one protocol which we designed in Tata Memorial Hospital, combination of 3, that goes hand in hand. So I will say these systems, whatever we are doing, they need more scientific scrutiny before public use. So individual experience should be taken as a baseline, and then there should be pilot studies and other studies. So I don't mind your suggestion. And
in short, what you are trying to say, let me rephrase it in this way, that you are trying to say that we should have a 3-arm study, a randomized controlled trial in one way, 3-arm. One study is considered as a control group. Second study, we can call it as conventional group. And the third study, we can call it as an integral group, where then we can see that how
there is one more group. Standalone Ayurveda, standalone allopathy, and both together.
Okay, so then 4-arm study.
No, there is no control group in cancer because if you do control group, patient will die. We all know. So in leukemia, you cannot talk about it because a patient or leukemia cannot survive without any medicine more than 1 month. So no control, either conventional arm, standalone Ayurveda, and both together. But it will need a big ethical issues because first of all, you have to establish mode of action. How does they work? What is the science behind it? So hypothetically, it is very good suggestion, but there are so many issues because there is a group of Indian Oncology Network. 467 doctors are part of the DM oncologist, and I'm the only Ayurvedic doctor who have been given membership of that. So we discuss, we meet every 6 months. So what we are talking, we should be very rational, ethical in our approach rather than emotional and irrational.
Thank you very much, sir. So that gives a big insight that what we have to do in future and in which direction we have to go. So without taking much time, is any other person who wants to ask question can ask question.
There is one raised hand, Akash. He's been there for a while, so I think this will be the last question for the day. Akash, please unmute yourself and go ahead with your question.
So, Dr. Vaidya Prakash, these copper bottles or utensils which you suggested are good. Is it mandatory to have them isolated, to have them unearthed, not in contact of earth? I've heard that the ions pass through earth and then it doesn't benefit. So what's the best way to make best use of the copper utensils?
No, I usually say that people usually drink water by keeping in copper utensils. And I say if they keep only overnight, so they have a purgative nature. So people say that they are not constipated. Besides that, I have not seen any effect. But I am not the one who will be right person to answer. I am only a Vaidya who is sharing experience after making medicine and treating the patient. So a very little experience as a preventive for other things.
Okay, thank you.
You're welcome.
Thank you so much. If you permit me, I'll just ask you one last question and then we'll call it a day. May I ask what's the survival rate is of the patients who come to you?
The question you asked me, this question came to me on 16 September 1998 by none other than Mr. Dr. Abdul Kalam, who was President of India and who was an acclaimed scientist. So he asked the audience, which was consisting of doctors, statisticians, how do you rate his success? And I was surprised to listen the answer of the statistician. He said, sir, he is treating dying patient. And in dying patient, he cannot success rate 1 to 1. So if he is treating one case out of one, that is called 100%. So sir, his success is amazing because they are not treating. But when I told you the success story, that 15 patients enrolled for the treatment, 11 could complete 90 days treatment, and out of 11, all 11 claimed successful. That means it was foolproof. So we have done only one pilot study which shows 100% success rate. Now the thing is, what is the medicine? How does it work? That has to be done. So I am not here to tell that I am a big man. I am saying that Rasa Shastra medicine has a definite role in the treatment of leukemia, and that has to be explored and scientifically developed for the betterment of the immunity. That's it.
Thank you so much, Vaidya Prakash. Thank you for your valuable time and sharing your experience and your valuable research with us. We all at Union Yoga Ayurveda Singapore wishing you all the best with your practice, and I hope your research gets acknowledgement worldwide, and the scientists will get to it and they will get to the core of it, and we will all be thrilled to find out how it all works, and hopefully in the future we'll be able to heal more people. Thank you so much.